So we have an ER doctor by the name of J Mac who's facing backlash for posting on his TikTok the following question: why do Black people turn on their phones during medical visits? Take a look.
I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist. A significant amount of my African American patients, while I'm doing a history and physical to understand better what's going on with their problem, they have someone on the phone. A large percentage of my African American patients have someone that's there in the room even though they're not there in the room. Why is that? Is this for emotional support? Is this to make sure that they're being treated fairly? African American people are currently and have historically been mistreated and endangered by the American medical system. I posed a question to the internet yesterday about an observation that I had made as an emergency medicine doctor, that a disproportionate amount of my African American patients were on their cell phones during medical encounters. And I thought I knew the answer, but I asked why. And there were a lot of people that were upset that I would talk about this on social media, and they were upset that I wasn't talking directly to my patients about it to get the answer. And I 100% get that. I should absolutely be doing more in my personal practice, in my immediate environment, to help make the medical environment a safer place for Black people. But it was my suspicion that this was rooted in very justified mistrust and fear of the medical system. To everyone that I have triggered and offended, I apologize.
Well, Dr. Mac, the short answer is yes. We don't trust y'all. Our pain isn't taken seriously. We are stereotyped and prejudice is against us. When we come into the ER, God forbid if a brother is wearing a hoodie and baggy jeans, that they must be there for drugs. We're accused of being drug addicts. We are accused of faking our pain or whatever it is we're going through. In Canada, the lack of race-based data is stacked against us. So oftentimes, they don't even know how to treat us. So we're treated like human guinea pigs and poked and prodded and tests upon tests upon tests, with in the end being told, I don't know, or it's just you, and different prescriptions time and time and time again, try this, try that. And so when we go into these rooms, we're also not treated right. We're not treated with respect. We want to make sure that we are armed with evidence. So unless a friend or a family member can't be with us in the room, you better believe there's going to be a virtual person in attendance. So yes, we're turning on our phones, either audio, either video, FaceTime, and we are keeping that as evidence. I myself, when I go to the doctor's office, I turn on my phone, whether it's speaker so I can get audio or it's video, and oftentimes the doctor will ask me to turn it off, and I say no. I have every right to record this, and when I go with my parents who are in their mid-80s and have all the things, blood pressure, blood sugar, etc., I make sure to turn on my phone as well, and when they ask me, I say no. So we have every right to make sure that we protect ourselves, because the medical profession, the healthcare system, they're not doing anything to protect us. So now he walks it back after all the backlash he received and apologizes. He's only apologizing because he got caught. Had he received all of the backing and support from his fellow colleagues, which are them folks as well, he wouldn't be apologizing. But he already knew the answer. And the other thing, when you lead by asking, I hope this doesn't sound racist, or I don't mean to be racist, or does it sound racist if I say this, ... you already know that you are racist, or what you're saying is racist, or what you're doing or saying has a racial undertone. So Dr. J. Mac, no, we're not accepting your apology. And my question to you, Dr. J. Mac, is why are you asking? Are you one of those doctors that I just described that treats our folks this way and is prejudiced against our folks and mistreats our folks and doesn't take our pain seriously, or doesn't take our whatever it is we're going through medically seriously? Or do you not do your diligence in the ER, Dr. Mac? Let me know what you all think about this. Don't forget to like and subscribe. Also download the African Diaspora News app so you'll have access to content you won't see here on YouTube. As you know, they tend to censor us on all of these platforms, so we are limited in what we can report on, but not with our own app. So make sure you download that app. You can get it at the Google Store or at the Apple Store, and you'll have access to all this wonderful content. Grab that app. Also subscribe to my YouTube channel, EA Public Relations. Until next time, please be safe, everyone. Peace be.